Hi there, I'm Dr. Funke Afolabi Brown. I'm the founder of Restful Sleep MD, where I help busy moms like yourself and their children prioritize sleep so you can lead to your fullest potential. One thing that I do is that I practice sleep medicine. So a lot of times I talk on this channel about behavioral sleep problems and mindset and mind racing and insomnia and things like that. But my other hat that I wear, and I actually wear very frequently, is that I take care of children with medical sleep problems and parents as well. So today I want to talk about reasons why your child's sleep disruptions may be related to an underlying medical problem. And this is something that is very important, because while we want our children to be able to sleep independently so we can get the sleep we deserve, we need to make sure that there's not a medical problem going on, because you cannot sleep train through a medical sleep problem. And some of these sleep problems are actually pretty serious. They can affect their function, their behavior, their growth and development so significantly. So I'm going to just jump right in, and I'm going to talk about a few, and then just really some red flags that you may see that may make you want to bring this up with your child's pediatrician. Again, while I am a physician, I'm not your child's physician. So your child deserves someone who's going to really listen to your story and then guide you to, the right resources, the right treatment for your child. Now, number one, common cause of sleep disruption in children, in babies, in older kids, is what you call gastroesophageal reflux, or GERD, or reflux. Now, every child, especially small children, have this problem, because what happens is there is that connection between your esophagus to your stomach. There's something that we call a sphincter there, and that sphincter has relatively low tone in small babies. So you'll see a lot of babies spitting up. We call them happy spitter uppers, right? Really not much to be bothered about, especially if they're gaining weight, if they don't look uncomfortable. But we really start to talk about gastroesophageal reflux disease when you have things like your child is speeding up to the point where they are spitting up most of their feeds. As a result of that, they're not gaining weight appropriately. You're noticing that they're consistently fussy and irritable after a meal, to a point where sometimes they may actually refuse a meal, or they'll see the bottle and start crying, right? That breaks your heart, right? Or you see them back arching, or really looking fussy, or turning their face away from the bottle. At that point, you really want to pay attention, because we do need to consider some treatments. And those treatments could either be sort of some behavioral modifications, as well as medication if needed. So some of the treatments that I usually would suggest, you can try conservative things like trying small and frequent feeding, because what's happening is if you give them small frequent feeding, it reduces their stomach being so enlarged that they spit up, right? So some children do really well with that. Another thing that I would recommend is burping them really frequently. So you may actually have to pause feeding, burp them, continue feeding, and make sure that they give you some really good burps. Then something else you may consider is avoiding, or I would actually recommend avoiding laying them down right after feed. So you want to keep them relatively upright about 20 to 30 minutes after a feed. Then there are other things, practical things, like avoiding wearing tight diapers. So anything that has like, that's tight around their waist, a tight fitting diaper, things like that will make them have more reflux. So that's something to consider. Sometimes your pediatrician may recommend thickening their feed. So it could be thickening their oatmeal, their feed, their milk, their formula, or the breast milk. And usually we'll thicken with either oatmeal, rice cereal, and things like that. So again, that is very individualized. So you definitely need to speak to your pediatrician. You can imagine that if you have these symptoms, right, how that will manifest at bedtime. You feed your baby, especially if they're very young and they're feeding in the middle of the night, and you lay them down, and out comes all that milk, and they're, they're wheezing, they're uncomfortable, they're crying. They may take a longer time to fall asleep. So you see, you may be like, okay, is this a sleep association or is this a medical condition? So I want you to tease that out and bring it up with your pediatrician. Talk about their sleep log, what time they're feeding, when are they crying the most, and then you'll be able to figure out what exactly is going on. The second medical condition that I see that affects sleep is food and actually environmental allergies. So for food allergies, if your child has a milk protein allergy or things like that, you may see them have a rash. You may see them have a lot of reflux symptoms. You may see things like blood in their stool. They also get very fussy, very irritable after a meal. For moms that are breastfeeding, it may be something in the breast milk, something that you are taking that they're reacting to. So sometimes that is hard to tease out. And what I recommend is really a trial by error with your pediatrician to try to eliminate either dairy products. Sometimes you may be referred to an allergist to do formal allergy testing. This is really important because these children can also have difficulties with weight gain as well. Most of the time, the treatment is eliminating dairy, giving them a different type of formula that they'll tolerate better. Sometimes as a mom, you may need to eliminate dairy, and that tends to help, especially if you're breastfeeding. So again, these are treatable conditions, but if we don't address them, can affect our kids' sleep, and then we don't want to try to sleep them through food allergies, right? Third is eczema. That's a huge one. And I've had so many parents where we've gone through, sleep coaching and things like that. And they're like, I don't know what's going on. He's still waking up. And this is really having that really dry, itchy skin. You know, if you have allergies or eczema, you know how uncomfortable that is. So for a child who may not necessarily be able to express themselves, or who is even so young that they're not necessarily able to scratch themselves, imagine how miserable they can be. And really that can contribute to them taking a long time to fall asleep, right? They may be fussy, they may be tossing and turning, as well as making them wake up frequently at night. So tease that out. Look at their skin. If you notice that they have eczema and you notice that they're having a hard time with sleep, then definitely bring them to the attention of your pediatrician, because what they can then do is offer you a skincare regimen. It may be, some really heavy petroleum-based lotion at bedtime, which would be nice for their bedtime routine, right? Sometimes they may need steroids. They may need topical steroids, depending on how serious it is. But really, I have seen children's sleep just completely turn around so much better once we're able to address eczema. Now, another one that I see is what you call allergic rhinitis. Again, that's more of those seasonal allergies. But sometimes some children have all year round allergies where they're sneezing, they have itchy eyes, they have this post-nasal drip because things drip to the back of their throats. So you may see them really congested at bedtime. You may see them just really having that stuffy nose and, really having a hard time with staying asleep and getting very restful sleep. So if your child has that, I wouldn't ignore it. Again, some conservative things you can do is using like saline nose spray. Having a humidifier in the room is great. Making sure that their nose is nice and dry. Sometimes we may offer them actually a steroid nose spray as well as an antihistamine. Again, this is something you want to discuss with your pediatrician. Sometimes it may be something in the environment that they're reacting to. It may be mold, it may be dust, it may be a pet, dander, cats, dogs and things like that. Some children may have those allergies, especially after the first year of life or so. Usually they need about 1 year for them to really start to mount those responses. But sometimes you may see it pretty dramatic even in younger children. So that's for allergic rhinitis or seasonal allergies. Now, another one that I treat as a pulmonologist very commonly is asthma. And usually how that manifests is coughing, wheezing. Sometimes they'll get asthma attacks. Sometimes we have what you call cough variant asthma, which They don't do anything else. They just cough. They cough with exercise. They cough with colds. They cough around fumes, things like that. So those are some things I want you to pay attention to. Sometimes they'll have wheezing, which is this musical sound that they make. It's very uncomfortable. If you look at them during an exacerbation, they may have their ribs sucking in. And these symptoms tend to be really, really bad at night as well. So if your child is having a hard time wheezing and coughing and things like that, that's the reason why they're waking up at night. And most times they may need to be on different medications, usually what we call an inhaled steroid, as well as what we call a short-acting controller, short-acting bronchodilator is what we call it. And what that does is it decreases the twitchiness or the irritation in their airways. Now, the problem with that medication is that it's called levoalbuterol or albuterol, is that it actually can raise your heart rate and make some children more jittery. So if your child has asthma and you notice that every time you give them albuterol, that they just have a harder time settling down, or they're waking up more frequently, speak with your pediatrician. Sometimes they may be able to give you some alternatives. Sometimes you may need to work on the timing of when you're giving the medication, because that can also disrupt their sleep. So the condition itself, as well as the treatment, can affect their sleep, unfortunately. Now, another one, I'm going to give you the two or three big ones that I see, which are sleep problems that can, of course, affect your children's sleep. So medical sleep disorders. One is obstructive sleep apnea. Now, your child may not be like that, snoring like, an old man, as people say. It may be like a very soft snore. But if you're noticing your child is snoring consistently, say more than 3 to 5 nights a week, we call that habitual snoring. And that may be a sign of obstructive sleep apnea. It may also be due to allergies, but obstructive sleep apnea is definitely something we don't want to miss. And what is obstructive sleep apnea? It's difficulty breathing during sleep as a result of collapse of what we call the upper airway. Right? Think about it. You're laying down flat, that the tissues in the upper airway sort of collapse on themselves. And for some children, it may manifest as snoring. You may hear choking, you may hear gasping, you may notice that they have pauses during the sleep and then they wake up and start again. Many times they have very restless sleep, right? Because what happens is as they try to go to sleep, their brain is waking up to say, breathe, breathe, you stopped breathing, So they wake up, they're cranky, they may be hard to get out of bed, even though you're doing everything perfectly in terms of their routine and you're, they're getting enough number of hours of sleep. The quality of their sleep is impacted. Many times in children, we see it as a result of what we call big tonsils, which is right at the back of your throat, as well as adenoids, which is right at the back of your nose. And for these children, the first step, one, is to bring it up with your pediatrician. Okay, if your child is snoring, it may sound cute, but it may be the sign of an underlying medical condition. So you bring that up, they'll refer you either to an ear, nose, and throat doctor or a sleep doctor, or they may be able to order what you call a sleep study. And that sleep test occurs usually in a sleep lab where we're just monitoring their breathing all night long. We have different stickers and stuff. Nothing hurts. And then we can get a sense of, is this snoring just snoring? Is this snoring that's causing apneas or pauses? And if it is, how bad is it, right? And so once we get those results, we then decide, okay, do you need to see the ear, nose, and throat doctor for them to take those tonsils? Because that's usually one of the common reasons. And there are also other treatments like CPAP, which is a machine that really, literally through the use of a mask, forces air to the back of your throat. And I have a lot of kids on that as well. But if your child is at the point where they're needing that, of course, you're under the care of a sleep doctor. That's sleep apnea. Restless leg syndrome, or RLS, is another condition we see in children, and this is it's quite common as well. Essentially what it is this discomfort that they experience in their legs, usually their lower legs, in the evening typically, and it's associated, some children will call it as a creepy crawly sensation. Some children have said things like, it feels like there's spiders in my legs. Sometimes it's mixed up with growing pains. It's a little bit different. And so what those children end up needing to do is moving their legs frequently for them to get relief, but that relief is usually short-lived. So think of your child who is laying in bed like a good kid, like he said, You're going to be a good boy, good girl. I want you to lay in your bed and, I'll see you in the morning. They're laying down, but you notice they're tossing and turning. They're kicking frequently because of that discomfort. Sometimes they may say, I need you to rub my legs. So if your child is saying, Mommy, Daddy, rub my legs or something of that sort, you may want to pay attention to that because that may be a sign that something's going on. Another thing you may notice is at night, in the middle of the night, they may be kicking a lot. Kicking. That's also something we'll notice. So this restless leg syndrome, again, is a clinical diagnosis. Usually you will not need a sleep study. For those children that have frequent kicking during sleep, many times we will get a sleep study because that's sort of in the same family as restless leg syndrome, but it's called periodic limb movement disorder. And they have a way that they're kicking very rhythmically during sleep. So we can diagnose that and then we can offer you treatment. For many children, it's associated with low iron stores. And most times once we check an iron level and it's low, we're able to supplement and that helps. In some children though, we do need to step them up and start them on medications to help with their symptoms because it's really uncomfortable. Now, the last but not the least may not necessarily, actually, yes, will disrupt sleep. I see it more in older children. So say in teenagers or 10-year-olds and over. And that is called narcolepsy. Narcolepsy is this condition that we see in children. Actually, we diagnose it a lot in teenagers, but you can see it in younger children. And of course, we'll see it in adults where they have this irresistible urge to sleep, even after getting relatively sufficient sleep at night. So you're seeing them have either sleep attacks, they have this need for naps, they have something called a phenomenon called cataplexy, where they suddenly have loss of muscle tone. Sometimes that can be triggered by emotion. Sometimes that can be triggered by surprise or things like that, where they suddenly may either buckle over or fall, or you notice a part of their face just go weak. If you notice your child suddenly getting very clumsy with emotion. I had a child who every time her team scored a goal would just suddenly fall over. So that was the emotion, right? So it's very, very interesting. But this is a condition that we definitely need to know about. So if you notice your child is excessively sleepy, needing to sleep more and more, and is having those other symptoms, sometimes they'll have hallucinations and things like that. You want to be sent to a sleep physician because we make that diagnosis. We do a sleep test and what we call a nap test or a multiple sleep latency test to make that diagnosis. And that's something that we do not want to meet. Most times children will need medication for a long time. There's a lot of research going on to look at different options in terms of medication for treatment. It's a chronic, long-standing disease, so it will have implications in terms of as they grow older, what kind of jobs they can get, what kind of accommodations do they need in school. So very, very important, because we don't want your children struggling in school if they have an undiagnosed medical condition. Now, I've gone through a lot, so you may need to watch this again and again and just kind of listen. And a lot of what I've done is really giving you the highlights of some common sleep problems that may be causing these sleep disturbances for your child. And that can either be a medical, just a general medical sleep problem, or a primary sleep disorder. Whatever the case may be, your child's pediatrician, you are your child's best advocate, right? They may not necessarily be able to tell you, but really bringing this to the attention of your child's pediatrician will get them the care that they deserve. So if this video has been helpful, I know it's a little longer than I usually do, but I actually have a few long videos, but it's good stuff. I want you to like it. I want you to share with those in your community, and I want you to subscribe to my channel so that way as new episodes come up, you will be the first to know. Until next time, I hope you rest well.